And everybody gets quiet. Stay in the race.
All right, we'll go ahead and call the meeting to order. Can we have a roll call?
Director Leach,
Present.
Director Brown,
Present.
Director Morales,
Present.
Director Jeffrey.
Present.
Thank you. Director Stanisek is absent.
Good.
We have quorum.
Awesome, thank you. Let's start with the pledge.
Ready to begin. I would like to leave of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, can I have a motion to approve the agenda?
I so move.
Second that.
Who are we taking a second? Rochambeau?
Terry.
Okay.
Any discussion?
Director Brown,
Aye.
Director Leach,
Aye.
Director Morales.
Aye.
Director Jeffrey.
Aye.
Thank you.
Okay, next is the public comment section. I would just ask if you have any comments that are specific to an agenda item, like the diabetes program, just go ahead and wait until we get to that section of the agenda. Do we have any public comments that are not related to anything on the agenda? Anything online?
No, and we had nothing emailed to us.
Awesome. Like I said, we'll get back to public comments when we get to agenda items. We have a presentation to start out. We have our youth fitness grants and our check presentation.
Okay, you want to call the first group?
Yes, please. All right. We have Warriors, Warriors soccer, please.
So just as we're getting ready to take pictures, I just wanted to thank everybody for coming out. This is definitely a program and a grant that I was definitely really passionate about, the board's passionate about. So we're excited to hear more about your results and hopefully grow the program.
So why don't we have the board stand here and we'll have you kind of join with them, and that way we can get a quick photo.
Come on over, you get to hold this giant check.
Thank you.
Let's type that there. Let's type that there. How's that? Yeah. Maybe come down this way a little bit.
There you go.
There we go. That's good.
It's not gonna roll very well. We got the brakes on it. We can crop it later. Yeah. 1, 2, 3. All right. All right, in part of the inaugural first year for the youth fitness, we'll do the second one, which is the
Boys and Girls Club.
Boys and Girls Club, and are also in the house.
You're a pro, Alex.
She's done this a few times.
Does
Remember, this is the one you can't cash.
Okay.
We will give you real checks, we promise.
It's not a Potemkin village.
Just getting a bunch.
The real checks, that's when you really.
And you're welcome.
You know, Alex wants this. You should be really interested in this.
Thank you very much.
Thank you, Liz. You bet.
And just letting you all know while we're doing a changeover behind the scenes, this is the first year for our youth fitness grants. What these groups will be doing is basically providing us some feedback the following throughout the year, just to kind of get some impressions, satisfaction, feedback from the participants in the program, see how this is making an impact on their health and their well-being. And we're grateful to be able to have this new grant program.
Absolutely.
One more. Oh, yeah, so the bulk of the room, y'all in the back, come on up. So you guys might have to actually come forward and let the kids all intersperse with you. Don't be scared. They're really nice, I promise.
Yeah. No, we need a bigger space. Maybe something that, some of you guys might need to deal, or I don't know. Yeah.
We could brought all these.
You know what, when we go to do that site visit, we'll come to you.
Yes. Okay, now we all right. So one's in duck down a little bit.
Yeah.
Yeah, just a little bit. There you go. Okay. How about you over here? Yeah.
Yeah, there you go.
You got it. Perfect.
All right.
Let me go like.
You're the student, there we go. Student over there. Oh, yeah. Yeah, maybe scoot in just a little bit, yeah? Okay, cool. Suzanne, I'm worrying.
And then I'm also gonna do this way for Insta. Okay.
Awesome. Thank you, guys.
Thank you.
Appreciate that.
Thank you very much.
A real check.
All right, who wants the real money? Just kidding. Yeah. Oh, just kidding, none of y'all.
Thank you so much.
Thank you very much for coming out and
Their first competition this Saturday.
whatever you do, try to take as many photos. You're always welcome to send those to us. We obviously want to cross promote you through the various social media channels as well. Get the community aware of what you're doing. So share with us. Awesome. Thank you.
Thank you. Thanks for coming, guys.
Now the room goes back.
School night, school night. Thank you, Erin. Have a good one. I will be communication. Thank you.
So it's still a good size.
Oh, thank you, guys. We'll be in touch.
All right, thank you. Thanks, Bill. And then if you wouldn't mind, we were talking about moving to F1.
For sure. So, yeah, we're gonna skip a couple things for now, and we're gonna move to F1, the review of our 2023 audit. Rachel?
Thank you. We do have Paul with us. Paul is with Nigro and Nigro, who is our auditor. And we received the audit quickly, on target, as they said we would. So Paul, if you want to, say any opening remarks.
I'm here. Can you see me?
Yes, we can, and we can hear you as well.
Oh, okay, great. Yes, it was a great chance to come in there to the district and work with the financial statements this year. We had a chance to sit down and talk to everybody about the internal controls and the process that works there at the district. And then was able to receive the information timely, and we're able to get through the audit in a good time and present the financial statements for you here at the end of the year. And I'm here if there's any final questions. I heard you took a look at it at the finance committee, and I'd be glad to answer any questions if you have them.
Director Jeffries?
Thank you. I have comments, but I'll defer to the chair.
No, go right ahead.
Okay. Hello,
Yes.
I just wanted to note some of the content, if I may. I always look for how did we do? And I notice on page 29 that you did not identify any deficiencies in internal control, and that we consider a material weakness. I want to thank you for that observation. That helped board members sleep at night. Also on page 30, the results of our test disclose no instances of non-compliance or other matters that are required to be reported under the auditing principles. Also, I noticed good news on year-to-year shifts. We increased 1.73% for the net position of the ending year. Our total revenues from all sources increased by 29.98%. I'm going to call it 30%. And the total expenses for the district increased by 17.6%, which is expected because we expanded our staff. So your technical document comports with my experience on our financial yin and yang and up and down. And I just want to thank you for clarity in the report so that lay board people can understand it.
Good. We also included for you a dashboard there that you have a chance kind of at a 50,000-foot level can be able to review that and the changes between the two periods overall. So
Yes.
Yeah, and I just wanted to confirm that your group will be submitting the report to the Secretary of State on our behalf. Is that correct?
it's yeah. So by January 31st, you're required to submit what's called the State Controller's Report. So it's going to go to the State Controller and not the Secretary of State. So that's where corporations go. You're a government. So the governments will be going to state controllers by January 31st. We wait till we try to finish up all our June 30th audits right now and dedicate the month of January to preparing those reports and sending those off to the state controller at that point in time. So yes.
Fair enough. Good. I'm good.
Thank you. Director Ross, anything? Questions? I just wanted to say I appreciate the thoroughness of the report. It's you know, like Director Jeffrey said, I think it's pretty well spot on with how we see the financials. I also definitely wanted to thank you for the promptness. It's nice to get in early and be able to have plenty of time to review it and not be worrying about, you know, extensions and where everything is. So I really appreciate that. Thank you.
Good. Yeah, I mean, the only thing there to see to make anything, how do we, if we see something, say something, how do we make you better? The only thing that we can, move forward with this year is something that, a lot of agencies haven't had to really look at over the past year since 2008, only earning like 1% interest rate for so many years after the 2008 collapse. So with interest rates rising, remember, your portfolio, your investment, your cash and investment portfolio is a way to hedge against inflation. Let's say that again, that is what you use. So if you can make 5% interest, which you've opened up a California class thing account to make 5%, as much as you can put in that portfolio, that is going to hedge against inflation right now. So just remember that as you move forward into this year. We showed on the dashboard there that your portfolio made 1.1%, 1.16%. We would like to see you make 4.5% this year to hedge against inflation. It's easy money, but you need to be able to be a fiscal hawk and really work your cash management, something we haven't had to worry about over the years. Because remember, 1%, who cares? That's all we were getting. Now we're getting a good interest rate, 5% of the market. Please try to do as much as you can to make as much interest rate as possible. So that's just saying that's a talking point for all of our clients right now during an interest rate rise as we are right now. So
I appreciate that, and definitely seems like a lot of the other special districts are definitely going that route, and I think that's definitely a smart decision from our standpoint, kind of moving in that direction. So
yeah, your fiduciary duty, be a fiscal hawk and try to get as much as you can out of your portfolio because that's your hedge. So
thank you. Do we have any public comments on this item? Seeing none.
I'll just add, Paul, I know from the team, we were very happy working with you this year. Thank you. And thanks, Stacy and the rest of your team for really being so responsive and so easy to work with. I know Susan and I have been through this with a couple of different groups that did not make this quite as easy. So it was nice that it was painless this year. We're grateful for that.
You're welcome. Did you feel audited? Yes.
And just for that, we should disconnect. Thank you, Paul.
See you guys next year.
Thank you.
Chairman Leach, could we get a motion to accept the 2023 audit? I think that would be good for the record.
Absolutely. Can I have that motion?
So moved.
I'll second.
Any discussion on that item? Seeing none?
Director Leach,
Aye.
Director Moraz,
Aye.
Director Jeffries.
Aye.
Director Brown.
Aye.
Thank you.
Thank you.
Thanks, Jeff.
Thank you.
Appreciate it. Moving around again a little bit here, we're moving back to D1. So I imagine we have a number of public comments here for D1. I'll go ahead and we'll start it up with public comments. I have some cards here. I'll start with the cards. If you didn't put in a card, it's fine. I'll call you after I'm done with these ones. So the first one we have here is Marta. Maybe if you just stand up, you can come up front, you can stand right there wherever you'd like. Come right in.
So I think, what is that, the lifestyle?
That's you.
Okay,
Yeah.
okay. First of all, I just have to tell you, this program, that the regional health in Fallbrook has been phenomenal. And I do want to tell you that the women that you have, I call them the A-team, because they are phenomenal. So I just have to add that. But the lifestyle program came, for me, it really has been life changing. I've never had a problem with blood pressure. I've never had a problem with cholesterol. This last year in September, my cholesterol was 228 and they recommended statins. And my blood pressure was high. And I'm thinking, wow, I never had that. So I asked if I could have my cholesterol taken again in January, and it went down to 222, but she still recommended the statin. Then I found the lifestyle change program, and I can't tell you, I started in March. I took my cholesterol again, it was 205. Right now, it's 198.
All right.
So Bianca has, like I say, it's life changing. She's taught us, eat real food. If she said that once, she said it many times, eat real food. And just exercising 150 minutes a week. Well, this week I did 300. You know, I love it. I just walking, the elliptical. I mean, it's just been amazing. So, and I can't thank her enough, and her staff. So anyway, thank you, and I really do appreciate you all. So, thank you.
Thank you. Thanks for coming out. Next we have Robin. How are you doing?
Good day. On a personal note, I would like to say that the weekly meetings, I've learned how to eat right, healthy food. I've learned how to exercise. I'm retired, so in both areas, I didn't do either. So now I do, and I've lost a significant amount of weight. I feel better, and I advocate for this program to continue.
Awesome. Thank you. Appreciate you coming out. Next we have Suzanne.
Good evening, members of the board, staff, our team. This is an incredibly successful program. I'm going to look at my notes because I wrote them earlier and I want to touch on everything. What makes it successful? Well, the first thing is it requires the commitment of an entire year. And you have to be serious about staying with and starting this program. The group meets weekly for the first 6 months. And so you're constantly having the opportunity to get supported and learn more through those programs. There's a razor sharp focus throughout the program on the 2 key strategies for losing weight and getting your blood sugar down. And that's nutrition, healthy eating, and exercise. The 2 things that 98% of our nation hates to do, me included. I hate exercise. And if you go to the supermarket, as Bianca's pointed out, 85% of what you see there is manufactured food. And that phrase just put chills through our hearts. We're like, no, it's processed. She goes, no, it's manufactured. And she's right. So the 2 hardest things, someone said it's easier to change your religion than your diet. And we've all struggled with that. But the great thing is the materials in the program are short, concise, and to the point. The timing of the topics that we cover are really strategic. We just did one on what happens if your weight plateaus. Well, there are a bunch of us who have weight that's plateaued. Couldn't have been more timely. Accountability every week. We share how we're doing and it's a safe space. People are really honest about the struggles and we share good ideas. My colleague Robin and I both hate to cook. So we sit next to each other and we go, okay, so we hate to cook. What can we do about this? And we challenged each other to make some healthy meals and come back the next Tuesday and talk about the meals we make. With blood sugar levels in our country becoming such a major issue, I think it's something like a third of our nation is pre-diabetic, and most people don't even realize that they're pre-diabetic. This is such a timely and critical program. I've watched my A1C level every year get worse and worse, get closer and closer to diabetes. And this program is the one thing that's stopped that and is reversing it. And we're eating healthy. I exercise 30 minutes every single day. And it's all because of this program. So 100%, it's been an incredible success. Now I want to thank the district for having it.
Thank you. Next we have Cindy.
Hi, I'm Cindy Lester and I'm in the Lifestyle Change Program. I really like it. I like that we meet every week. I wish we would continue to meet every week instead of this, once a month coming on. Because I think it really, cements you with it and, doesn't stop excuses and stuff like that. It's taught me more how to eat and be more aware of what I eat. I've probably lost maybe 8 pounds in 6 months. And I'm just really thankful for it, the program. And I also like the other programs you have, the exercises, the yoga, the Tai Chi, everything. It's really, really good. And also making it for people who speak Spanish is really good. And I agree with Susanna and everybody else. And I hope you continue it. Thank you.
Thank you. Okay, Elizabeth?
Hi, thank you so much for inviting us to come and speak on our experiences with this amazing program. Now, if the CDC has had this in their curriculum for 20 years, you would know that there's something really great about it. So I'm wondering why it took so long for it to come to Fallbrook. I'm going to share with you something that was part of an exercise that we did after 1 month in this program. It was a little form like this. We had to write, it says, what's your why? And it says here, prior to joining the Lifestyle Change Program, there was an experience, a conversation, an emotion, and or a thought that inspired you to take advantage of this opportunity. What has been the motivating force behind this decision? Why are you here? What is your why? And this is what I wrote. In the spring of 2021, I was experiencing shortness of breath and subsequently had an angiogram on June 30th. I had struggled with high blood pressure, morbid obesity, and was pre-diabetic for many years. Now there is, just a little aside, there is a photo over the fireplace at our house that my husband calls the aha and others call the trophy wife photo. It was taken when I was 27 years old, 125 pounds in a nightclub in Acapulco. It's a wonderful glamour girl moment photo. But if I had one more person come to my house and say, who's that? Because when I went for that angiogram, I weighed 320 pounds. And that wasn't just because of the pandemic. So I was a compulsive emotional overeater of sweets and processed carbohydrates and manufactured ones too. And I led a nearly total sedentary lifestyle. A computer whiz but a sedentary lifestyle. I always felt walking was a waste of time. Being diagnosed with angina was both a physical and a mental wake-up call. My cardiologist was very frank when he delivered the post-procedural analysis. I had dodged a bullet as the surgeon did not have to insert any stents. However, I did have microvascular angina and it could get worse. I was given medication and sent to a preventative cardiac rehab program where I was helped with exercise and told to follow the Mediterranean diet. Subsequently, I have totally given up processed sugar, diet soda, and most processed foods. Because applesauce is a processed food. Okay,
You should make it yourself.
we've learned that, okay? My cardiologist challenged, and these were here with his words, that I could help my heart not get worse and possibly even better. And that turned a switch in my mind. And it has kept me going, but that cardiac rehab program ended because of insurance constraints. And there I was left wondering, what am I going to do? And that's when I saw an article in the Village News. I knew that I needed a group environment to sustain and increase my progress. Doing it alone is so much harder and it's lonely. I looked forward to learning, this is what I wrote, I said, I look forward to learning from this program and the other participants and to even make some new friends. Becoming healthier and happier is my why. This program of lifestyle changers is a great mix of science that you find like at Weight Watchers, but also emotional support like you find at a support group, the anonymous program, Overeaters Anonymous, and I participated in both. This program is much better because it combines those two realities. And just to give you results, I am halfway to my goal. I am down 80 pounds, 25 of them in this program in 5 months. And I have another 80 to go. So I really want there to be a second program. And all of my labs have, my cardiologist just looks at the lab and goes, normal, 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 normal. Okay, come back in 3 months. I mean, unbelievable. And I am no longer pre-diabetic, all of my cholesterol, all of that. I am less sedentary. I actually find pulling weeds a wonderful motivating movement to exercise. And my BMI has gone down from 58% to 43. And my next goal at the end is to hit 28. I have one recommendation, that the people who have been in program 1 be allowed to be mentors to the people in program 2, because the continuity will help them to succeed and exceed their goals and expectations. This has been a tremendous learning curve for any new program, and Bianca and her team have been extraordinarily helpful. They are trained, they are willing to turn on a dime if you've got a question, a need, a suggestion. Please vote for this to be extended for another year. Fallbrook needs it. Thank you.
Couple more cards here. Roxana?
Hello, everyone. So I'm gonna do my best to get through this without crying, because this is such an emotional, it's not just something that is simple that you just go to. It's not just a class that you go to. It's a lifestyle. It's a lifestyle change. It's a lifestyle program that we all need. So I'm gonna start off a little negative and we're gonna wonder why. So let's talk about a celebration of life. Why? Why do people go to a celebration of life? It's because somebody has passed away. A loved one has passed away. Or somebody has died that we know and we want to go and give honor to them. But here we are at the Lifestyle Change Program. We're not celebrating somebody passing away. We're celebrating life itself, that we want to live, we want to do well, we want to change ourselves. So we're going to ask a few questions in this. We're wondering why we signed up for the class. Why did my friends here? These are not just participants, it's my family now. So why did we sign up? What's the outcome gonna be? Why did we even want to do this pre-diabetes class? To learn, to maybe get knocked down again or not know what we're doing? But no, that's not it. Let's answer those questions. The Lifestyle Change Program has helped each and every one of us to learn how to eat whole foods, how to drink more water, how to do more exercise, how to do daily life vacuuming, pulling weeds. And these all are things that we do. However, we didn't recognize that they were part of a program. They were part of our everyday lives that we didn't even know that they can be life changing. So that's what we did. So why is this vital? Why are we celebrating life here at this program? We're celebrating because we don't have to be a celebration of life for somebody that's passed. We want to live healthy. So we are learning that not only for ourselves, how we feel every day, but this dominoes. It dominoes all the way to our friends, our family members who have watched us be sick and unhealthy. It dominoes all the way to the Fallbrook community. When we see someone who has passed in the village news, it makes us sad. One of our neighbors passes from an illness, it makes us sad. So this program has helped us to know that we're worthy, that we can do this. We have our instructor, our coach, and now our friend Bianca. She has helped us to know that we're worth every minute that we put into it. We have our weekly classes, like my friends said, is that we meet every week. Now it's going to be changing to every other week, which is fine. That's how the program goes. But let me give you a few small celebrations that we've had in our class. We have one member who shared with the class, and let me share, won't share names because we said what comes to our class stays in our class. We don't, it's very confidential. It's like a unit, a family unit. But this particular person has gotten below a milestone mark of the several hundred pound. He got below this. So some of us cried, we all clapped, we all had so much emotion. Some of us have shared that they can't walk for their exercise or their activity, but we've now joined the chair yoga class that you offer there. Some of us have said that we can't walk, another one, but now they go swimming and are into a little program that they have to swim. So why is this so important? It's because we started out as participants, but now we are a unit. We celebrate life because this has taught us that we're worth it. And I'll go ahead and read this actual part. We hope that this lifestyle change program will continue so that future Fallbrook residents can also share in celebrating their lives. They can live more productive lives, not just exist, but to live more healthier and more productive. So to the board members, thank you for hearing me out. And I hope that you can continue this program. I think as well as all my friends, that it's well worth it. And our instructor and our coach and our friend Bianca is amazing. Thank you.
Thank you. Greg?
Okay.
Well, perhaps the best way for me to explain the effect that this class has had on me is to give you sort of a short before and after. Okay, before I had an A1C 5.9. Now 5.7 and below is good, 5.9 bad. So I was pre-diabetic. How long? I don't know, maybe 1 year, maybe 2, maybe 10 years, but a long time. Okay, before I had heard the word calorie. Okay, I really did. I had to look up the dictionary. I thought it was some kind of tool you use to fix your car with. And so I figured out that finally. I was told they have to be healthy. You really want to go to the gym. And that makes sense, except my partner like golf was named Jim. I don't know why I want to talk to Jim about losing weight. He didn't have a clue. Okay. And then I was also before I was talking about weight. Well, yeah, I was at an absolute firm 192.6. And for someone who's 5'8", my age, blonde hair and blue eyes, that put me in a pretty bad category. Okay. So that was before, and I said you have to compare that with the after. Well, the after started 6 months ago. Okay. The after started with my A1C, it went down from 5.9 to 5.7. So here I'm no longer pre-diabetic, and that felt good. Okay. I learned all about calories. I learned that, for example, I can't believe I say this. Yesterday I ate 1,240 calories. Okay. Okay. And I wasn't hungry at all. Okay. I learned about the gym. Okay, it wasn't my golf partner, it was actually a place that's here in town, so I go to the gym every day for an hour and a half or 2 hours, and that's pretty cool. Okay, and probably the biggest, most obvious thing that we all concentrate on is weight. Okay, before I was 192.6. This morning I was 163. So in 6 months I'm down 30 pounds. Okay, and I'd like to say I did it all myself. I really didn't. Okay, I have that lady right there in her program to blame for this. Really did two things. You know, we all have things that we really appreciate. The two things that she did that I truly appreciate that I don't see done have it being done very often is, first of all, she provided the motivation to do it. Okay. The second thing she provided is methodology, because you can be motivated and want to do it, but unless you know how to do it and have ideas, you can't get there.
Yeah.
So thank you. You did wonderful. Appreciate it. Yeah.
That's all the cards I have. Does anybody else here have any comments? No comments? Anything online? No. Well, I just wanted to thank all the people for your comments. Obviously, your passion for the program definitely stands out, and the passion for the staff. Obviously, Bianca and Teresa, you guys are doing an amazing job. It's nice to hear like the passion that you guys have for the program. And for all the commenters, I would just welcome you to keep coming out to the board meetings. It seems like you're interested in a lot of what we do as a board. It's great to hear the experiences, so it gives us a better idea of what does a board. So thank you so much. So we have a presentation. I'll give you a minute. Yeah, no, but we have we'll have a presentation from staff about the program, but it's definitely looking like it's doing pretty well.
You can do this, Bianca. I'm doing it. We're ready.
All right. Well, thank you so much for coming out. I was not expecting this. But then I'm also not surprised because our Fallbrook, Onsall, Rainbow, Duluth residents are amazing. And it is so easy to do a program like this because we're surrounded by this amazing community with so many local resources that we get to tap into. Some highlights of this program was, bringing in, our local celebrity chef, from 127 to come in and teach them how to, Chef Otto, come in and teach them how to cook healthy, inspiring them to come and how to order healthy at a restaurant without feeling that they're going to, impose, on a chef. That there's nothing that anybody has to be ashamed of ordering when ordering healthy, that they can go out and experience life. Other highlights, I personally do love to cook, and I do cook healthy. And so I've been able at every session, bring in little snacks and, prepared, homemade prepared foods to share with them. And, they get to take pictures of the recipes, and that's been just wonderful. I think also too, one of the greatest highlights about this program is the collaboration that I have and the opportunity that I have to work with Skinny Jeans Project. The crew at Skinny Jeans Project is immediately there and available when I'm having any kind of questions, when I'm considering something. I may have like an idea of doing, a particular, aspect, for the program. So for example, Elizabeth brought up, what is your why? That not necessarily was part of the actual CDC curriculum, but it was an important tool that I needed to understand our participants better, so that I could tailor and really kind of hone in, that they're gonna get something out of this. And when presenting that to Skinny Jeans, they're like, absolutely, yes. Have it in written format, do it this way, this is a great idea. There are so many, they have done this program so often and so frequent that there is almost an idea that I have that they've not already tried. And when I can write an email and I have a question, if one of our participants is going through a life challenge, being able to call on them and they, here's how you approach this, remember you're a coach, you have other resources, you have professional resources available, you make sure you're holding them in this way. In addition to that, working with Skinny Jeans Project has expedited the delivery of this program. When I was creating the curriculum, I had probably spent about 6 hours on an Excel spreadsheet determining how to move and deliver each of the modules that we're required to do. Call them, hey, I want to throw this at you. And they're like, oh, you've already got an Excel spreadsheet and you can actually plug it in and it's going to send you all the links. Would have saved me a lot of time. So then now at that point, I knew, call them first before you're gonna waste hundreds of hours. And I'll tell you, as somebody who's worked with a lot of different contractors or
Vendors.
yeah, vendors, there's a lot of times when you go into a business relationship with them and they cost a lot of money and you could have probably received that research in a Google search.
Yeah.
This is very different. They have actual legitimate experience in delivering this program. And it is a valuable resource. Working with Marlena and working with Aya is phenomenal. And so I wanted just to kind of bring up, we're in the halfway mark. You've heard some of our participants mention that we're moving from working with each other weekly into every other week. That is a design of the program. The objective is to get the plane to fly on its own. Get them to walk on their own. I am still meeting with members weekly. I'm just actually doing one-on-ones on our off days, so I can really start to hone in on, if there's any additional challenges that haven't been addressed. But so far, I just wanted to identify the CDC has specific goals for this program. Members must attend an average of 8 classes in the first 6 months for they to qualify as receiving the actual data that the CDC is going to take a look at. Of all of our members, 100% of them have done it. That's amazing. Also, members aim to lose 5% of their weight during the whole 12 months of the program. Of our members currently right now, 1/3 of them have already met that goal and it's the halfway mark and we're just getting started. I say we're just getting started because I'm like, let's go, but you could really start to see that the independence and the motivation is there, as I'm sure you're witnessing. Hypertension, of 15 of our participants, 7 were previously diagnosed with hypertension. 5 to 7 of the participants have a blood pressure within normal range. I am able to go into our classes and actually take their blood pressure as I'm professionally trained. Also, the big one is our A1C panels. So what happens with the program, you receive your A1C in the beginning of the program and at the end of the program so you can see the results. We have a couple of our members that have already done their A1C midway, and 2 of our members have broken out of the pre-diabetic realm and are now within normal range. I'm looking forward to seeing what the rest of our A1C levels are. We did start with 20 participants. We currently have 15. Of the 5 that dropped out, it was all due to family or medical reasons. It was not due to disinterest. And yeah, there is excitement every day that we get to meet, and what's really important is, you know, creating a program that people are attending that, yes, makes them feel good. But what really makes them feel good and lets them know that they're moving in the right direction are the actual numbers, are the actual blood panels, are the actual results, are actually getting phone calls from their cardiologist. Can I meet with you? What is it that you guys are doing over there? And so I just want to thank all of you and give you kind of like my experience in working with the Skinny Jeans Project, the experience, you know, bringing, you know, our, you know, my friends and our participants here to share their story with you. And I really, really am grateful for all of, you know, the foresight and the support that our board has provided this program and the opportunity, you know, that we've been able to achieve simply by, you know, the board opening the door. You know, so thank you very, very much.
Thank you.
Thank you.
Thank you, thank you, thank you.
Thank you.
You can stay if you want.
Yeah.
You don't have.
Yeah.
We try, Bill. We try.
Bye.
But
Do we have any, Teresa, do you have any other comments or anything else from staff?
There's not much I can say. It's a phenomenal program, and to be doing something that achieves measurable results like this is really amazing. And personally, I'm passionate about it because I think about the legacy of the district. And this is my own thing. I look out 10 years. And I go, what if 10 years, 15 years from now, the incidence of diabetes could be lower in our area? Like we could really have you know, hit the #1 health need in our area and the country through work like this. So, and Skinny Jeans as a partner has been amazing. To do a program like this, the amount of work, Bianca shared about the 6 hours with one spreadsheet, that's like nothing compared to all the moving pieces with this program and what they provide to help Bianca be successful in her coaching and working with them. One of the amazing things they do is they provide, they analyze the data for us. We put it in and they come back and show us where, you know, people are tracking at and what goals have been met. And it helps, you know, Bianca know how to tailor things and, you know, where the program's at, where that would take so much time to analyze that. And it's just like, ooh, here's your report. And so they have been just really amazing. And then as you guys know, our program, what is the one that started through the cohort and we went through the academy. And so next week on Monday, we will be presenting to be there on San Diego, which is symposium for cardiology and heart health on our program and the district's efforts in this area. So I think the quality of this program and the CDC certification says something about our district. And like some of the participants shared, the CDC has this down. They've been doing it a long time. And we actually learned a new stat today as we were preparing for next week, that this is way more effective than medication, even than taking metformin. 31% chance. If you're 60, it's a 58% success rate with DPP. And if you're over 70, it's a 68% rate of not getting diabetes compared to medication. So this is very real medicine, you know, and I think it is the future of healthcare, lifestyle change and addressing lifestyle diseases. So.
Great, thank you. Terry, anything?
No, that's good. That's amazing.
Yeah.
Absolutely amazing.
I am so impressed with the empowerment and encouragement and the enthusiastic, the energy that they have created to know that they are able to take this into their own hands. And exercise is medicine, eating healthy. If you go back to how our grandparents used to eat and what we were taught as children, we have to reprogram our thoughts about what is considered food. And then besides intake, food, healthy food and nutrition. And so they're learning these new steps. And it's so encouraging because once they realize they can do this, they want to help other people do this too. And with the way medicine is right now, I'm sorry. We need to be our own patient care advocates. So this is the best thing they can do. And I hope this sets a trend for not only diabetes, but cardio workouts. Maybe working out with arthritis, people that, you know, how much medicine can you take before your Zonko? You know, can you just get exercise or maybe eat therapy?
Is that the clinical term there, Zonko?
Zonko, that is mine. Do you know, this is the truth. A physician friend of mine said, the pharmaceutical companies have been peddling their wares for such a long time. At this stage in our life, they're even now talking about having cannabis as an alternate pain reliever or effective remedy to assist in the management of arthritis. And I thought, this is really amazing. Here we were 15, 16 years ago, and it was reefer madness. And now, oh, just cut a gummy in half and see how it works, you know? And I'm thinking, oh my word, it just opens up a whole new world as to what's really healthy for you. And I could say, yes, get off as many meds as you can. Take what you need to take. Have your doctor and a nutritionist, a specialist, whoever, oversee your care plan. But you ultimately have to work that care plan, whatever it is. And what you're doing is showing those candidates, those participants in your program, that they have the ability to change their lives through what they're doing. So kudos, congratulations. I hope it keeps on going.
I do have one question. So have any HMOs reached out to work with your program? What comes to my mind is Kaiser. I have Kaiser. I'm also diabetic. And they have some pretty good programs to help me manage my A1C. But it doesn't sound near as in-depth as and effective as what you have in your program. So wouldn't it make sense for someone or an entity who's so vested in our health in a financial sense to want to partner with your program? My question is, have any HMOs reached out to work with you, or you reached out to work with them?
So I'll answer on that one. Because we started this program as a pilot through the academy, which was grant funded to Skinny Jeans from the county, we were selected as a participant under that. On the go forward, if we do go forward with our partnership with J. Moss Foundation, which is the overall umbrella for Skinny Jean, they would be the ones who would work with those contracts to make sure that the Medi-Cal or Medicare is the primary, but all those private insurances would then be contracted and pay through that as well. So that's what that umbrella allows and brings forward to us in part of that partnership. Kaiser, in particular, would operate this program themselves. Traditionally, they would keep it under their own umbrella. That doesn't mean that they don't sometimes contract out with other groups, but there has been information from Marlena and her group over at Skinny Jeans that they are working with a lot of these larger entities. UCSD was one of the biggest ones that they're partnering with. So
SCAN comes to mind. And
a lot of these, because SCAN is Medicare, essentially, it's covered under that. It just really depends on how well it's rolled out in a community and who's going to operate it. The insurance may pay for it, but if no one's offering the program, that has been the downside.
What about, and I'm gonna be real naive here, and I shouldn't be because I know healthcare. Graybill isn't, I know that's.
Graybill was purchased. Palomar, is now under Palomar
Okay.
Arch Medical Group.
But wouldn't that be a similar kind of a
a consumer, so to speak.
Yes, they could offer it themselves, or they could pay for it as the broker manager of the health benefit.
Right.
So,
Be under a
yes,
wellness program.
it could be under their wellness, it depends on what their structure contract is for, but yes.
Okay. Director Jeffries, anything?
No, I was in on the initial conversation for this many clicks back. And it's so heartening to see it not just grow, but like pulsating is a great word. And I know several of these individuals and I've never seen them this enthusiastic. So something has hit the core. So thank you to the team.
Good vibes.
Yes.
So yeah, no, I think it's an amazing program. Personally, I think that it's great to see the testimonies from the people that are impacted by it. So so many times we ask people to come out for stuff and you can really tell that those people are passionate and it's definitely affecting their lives. So I really like I guess the simplicity of the program. I mean, it's stuff that you don't necessarily want to do, but you have to eat right and exercise if you want to get healthy, you know, and there isn't any sort of magic pill you can take or, you know, easy road. I mean, it is easy once you get used to it, but it really is about nutrition and exercise and like I said, I think it's a great program. We just have, I guess, what's the cost per year, Rachel?
So the contract it's a $50,000 a year contract for them to manage all of the data, submit it to and from, and keep it certified under the CDC. And then eventually as well, any contracting that may happen with outside payers, the ongoing support and education training. I will say from the time we started this through even to now, Bianca has come back many times and said, oh, there's been a new change to the program where curriculums are different pieces, and Skinny Jeans has brought all of that forward so that we aren't trying to figure out how to do it. They're able to help train us. They've provided all the lifestyle coach training to both Bianca and to Teresa. So if Bianca goes on vacation or whatever decides she wants to sleep in that day, just kidding. Teresa has been the one who's been able to step up and run that. It is, as I recall, part of the curriculum that you have a train the trainer. The idea is that this first cohort can become the mentors for the second cohort.
Great idea.
And that, right, and then obviously that helps lead to long-term success. It's not just a snapshot. It is part of that lifestyle change program, so.
And wouldn't the contract also allow us, it would give us the bandwidth to do a second cohort
Right.
every year. So they would also be able to provide another coach.
Right.
So that we could have, you know, 2 going on during a year.
Right.
Okay. Would you start it like every 6 months, like
Yeah.
spread them out like that? Okay.
Yeah.
So you currently have 15 active participants?
Can I ask, how, was 20 the cap, or was that to start with, or was that just how many?
No, I mean, we,
Yes, the cap
yeah.
was set at 20. Bianca wanted to add more and we told her no. This is why I'm jumping in. It is a brand new program, but it is also labor intensive, as you can see. Bianca, to her credit, does bring passion to it, and obviously that translates to the participants. But when you start talking about bringing in a local chef to speak, when you start talking about bringing in all these extra pieces to really keep the group going, that is an extra effort that our team is able to do.
Yeah.
You can't do that with a group of 40. You can't do that with larger groups. Talk to a school teacher in an elementary classroom and they'll say a class of more than whatever is too many. 25 is probably reasonable. Yeah, so we capped it. In the original conversation I had with Marlena and her team at Skinny Jean, it was a happy medium. Because sometimes people need guardrails.
Do you have like a wait list or interest list already? Good deal.
And we'd be looking to offer it in Spanish as well.
Right.
Awesome.
That's fabulous.
So you'll lose kilos instead of pounds, right?
Exactamente.
So a $50,000 program, is that what I understand?
Yes, that's what the contract's for,
And maximum of 20 people.
per cohort.
So total 40 for the year, correct?
Right. Total 40 for the year if we're just doing 2 cohorts a year.
So essentially it's $1,000 a person, is that right?
For the cost for the 1-year program, yeah.
I'm impressed by the results. Absolutely. Just something to think about. Seriously.
Yeah,
Yeah.
no, I think it's. a
When
great
you think
program.
about how much money they're saving, by taking these proactive steps, their medication, test strips,
Well, just the cost of the medical care they would receive when they do become diabetic, or managing the symptoms if they do get out of control. We know that the cost savings overall is substantial.
absolutely.
And that is a more of a community impact, and it's much more difficult to
That's a very
quantify.
good point, and it probably is in our best interest as an investor in this program, which I'm totally okay with,
Yes.
to be able to have some of those numbers that support and justify $1,000 per participant.
Yes.
Because the average person out on the streets and our constituents may not get that. So it will be helpful if our staff could pull some numbers together that says, you know, for $1,000 program, in the long term, we could save $25,000 in healthcare for this person.
Yeah.
That makes a lot of sense to me.
Yeah, and we can easily bring that data back. That is one of the nice things about the partnership. Is that because they are doing this program throughout, and because they have these certifications, they're able to bring that larger data to us. We're not out there figuring this out on our own.
And we need to have that data available.
Yeah.
That we can put out there.
Maybe a tab on the website or something.
Oh,
for the
absolutely.
program. Yeah, that'd be
Yeah.
great.
Absolutely.
Yeah, we can build out more of that onto the.
Yeah, but it's great to see the passion, and I mean, it's great to hear the people talk about their mental health. You know, really like them being in the cohort and how they're supporting each other. I mean, it's great with mental health, and then looks like we have some real world data on some of the physical health. So I mean, I think, you know, like Director Brown said, if we get some of that together, I think that's a great program. So,
This is the tax dollars at work,
Yes.
proactively. I'm just all for it.
and it's already budgeted or?
Yes.
Already budgeted,
Yeah.
So,
Because we didn't know where we were going to be in it, we earmarked it into there, knowing that if it wasn't used, there would be plenty of other community things, but obviously we're seeing the results.
yeah,
Terrific.
absolutely. So it's it's E10 on the consent items?
It's
that's correct?
E10 in the consent item.
Okay. So if we don't have anything else, we'll just move on, and
Okay.
we'll put that on, we'll put it to a vote with the consent items.
Okay. Thanks,
So-
Bianca.
Thank you. Yeah, absolutely. Okay, so where are we here? I guess we're done with D, on to E, consent items. We have a number of different reports in here. We had an email go out where we kind of discussed, I guess, the need to try to put some of these in here. I would definitely encourage all the board to try to get into your board packet early and just read all the stuff, ask questions, contact staff early if you have any questions. And then don't be shy, feel free to pull any of these items as we come. I don't mind if you want to look at something or discuss any of these items, so feel free anytime they come up, and we can do that. Can I have a motion to approve the consent items?
So moved.
Can I have a second?
May I just clarify the procedure here?
Yeah.
Don't we need to, when consent items are approved, there's no further discussion. Do we need to pull 9 and 10, or I'm cool with moving right along with everything. I'm just checking.
You would, Jeff, correct me if I'm wrong here, if you have something from the consent that you want to have discussion on, you would pull it before we do the vote on the
Okay.
consent.
Okay,
Well, at the point in time that you have your second, you could then ask for questions or comments on it.
Yeah.
And that's where we would address.
For discussion.
Yeah.
I'm very
So good
familiar
job.
with this, so cool.
Does that work? Okay.
Yep.
So, can I have a second on this?
Second.
And then discussion items. Director Jeffries, I'll let you go first.
No, I've reviewed these items and, gotten the information I need, so I'm fine.
Okay. Anyone else? Just real quick for me, just for, Rachel, if you could just from the, CEO report, portion, maybe just kind of give some, report out from the Lions of Sight event.
Oh, sure.
I attended, I'm not sure how many of the board members attended, but I thought it was amazing to see
Fantastic.
again, another event to see the impact of one of the programs that we're doing. If you could just speak to that for a minute, at all.
Sure, and I don't know that I have the data in here. Do you have it at the top of your mind? Perfect, I'll defer to Teresa since she's got that info.
Thank you.
It was a great event. I wasn't there, but so I have heard.
But I was there, even though she has the data.
I was there, so we had, we estimate, 300 people in attendance.
Fantastic.
So it was wonderful. So we provided 152 vision screenings. So that was great. 5 clients were referred for treatment of eye diseases. 60 clients received eyeglasses for the first time. And 124 pairs of eyeglasses were distributed.
And we were partnering with the Lions Club?
Yes,
That's
Awesome.
correct. Yep.
Yeah,
So it was really wonderful. We did 45 vaccinations. We probably would have done more, but I guess there was the provider had some issues getting some of the vaccines, so their COVID wasn't available. But even so, we gave 45 vaccinations. We had a dental mobile unit there that did 10 screenings and fluoride treatments. So then we had youth activities and entertainment, and so it was really, we had little smoothies for people to have like a little healthy treat. So,
And it was very, very busy, and even though we got a little bit of rain, in the morning, we still had a good crowd. North County Fire was also there with engines and, one of our joint ambulances up front, which obviously helps draw a lot of interest so that we could talk about what that partnership was. I was over in that area bulk of the day, so I had a good opportunity to chat with folks as they were coming in and, you know, as they would ask like, well, this is the fire department. Oh, yeah, but did you know the health district also does this? So really helping to educate the community in that partnership.
we had some resource booths that were very, it wasn't like come one and all, it was very targeted. We had some tutoring, opportunities for kids to volunteer, youth services like Turn that had some behavioral health. We had WIC there, we had food pantry there, you know, the library with what they have to offer. So it was very tailored towards family resources.
And again, Teresa and
Migrant services is here.
Teresa and Bianca, who really spearheaded this event. This is Bianca meeting apparently. Bianca did a great job of really coordinating a lot of our community youth to come out and be entertainers. So that you got those families to come out and be involved as well, so that their kids were integrated into the entertainment. That always brings out parents and grandparents and tias and all those deals.
We even had a sheriff's department, overseeing the traffic.
Yeah, we had the volunteer
Volunteers
sheriffs,
were there. Really nice.
managing some of the traffic out front, because with 300 people coming in, there's a lot of car traffic.
And it's difficult with just one car coming in out of their left.
Yeah.
Yeah.
Yes, when you're exiting, you must turn right. Do not turn left. There's a sign.
And there's also a cop there going.
Yeah, when the cop is standing there saying you gotta go right, it really helps keep the traffic flow.
Well, I'll join the choir on this. It was a fantastic morning. And the array of tables of community-based, volunteer and school-based was fantastic. The ballet folklorico was, I don't know whether you,
I didn't get it.
everything literally from 3-year-olds all the way up to
cute.
beautiful women and men who do this, and they are just illuminated. The whole site lifted up. So, and the Lions Club thing was so fantastic. Yeah. So thank you for that effort. And the connectivity for low-income families is really we finally got it right after the pandemic, and that's a real resource. So thank you so much.
Yeah, absolutely. I would just kind of repeat some of that. I thought it was an amazing event. It really makes an impact when you drive up to that wellness center and the parking lot's completely packed. I mean, I wasn't really sure what to expect with the rain in the morning, but, you know, I thought it was really well put together. It's great to see all the community partners out and some of the kids. And I saw the girls that were doing the dance. I mean, I thought it was just really well put together, and one of the type of events that we designed the wellness center for, and it's great to get people out and see the utilization out there. So really appreciate it. Really great job, staff, and looking forward to hopefully partnering with them again in the future for events. I mean, it's great the impact that it makes for somebody that can't see to have glasses. And I mean, was it 60 people with first time glasses?
60 people.
It's amazing. And before we move on, I would just point out that they are looking to start a Fallbrook chapter. So if
And they want you to be their president.
anybody's interested, apparently they need 5 members, so, you know, if anybody, Terry.
I was pretty sure they told all of us, Bill, that you're gonna be the next president. Pretty sure they think that.
Any other consent items anybody would like to discuss? I'm good. Okay, go ahead and take a vote.
Director Leach,
Aye.
Director Brown,
Aye.
Director Morant. Aye. Director Jeffries.
Aye.
Thank you.
Thank you. Okay, so we just, it's just, what do we have?
F2.
F2, Terry?
The finance committee in its discussions last week, wanted to consider and ask the board to consider investing some additional money in our California class portfolio, as it were, and especially listening to Nigro's beating us on us about only earning 1.1% last year, although we didn't have a lot of control over that.
Right.
I agree that it makes sense for us to try to enhance our returns as much as we can. Initially, I just had some reservations on to my mind, a new product for us. That's why I was stuck at the $1 million number. And I was actually not going to be comfortable with that at the one time. But after visiting with some of these folks up in Monterey, because California class did have a presence there, and we talked about asking the board to consider putting another $1 million in there. And I'd like to amend that to maybe make it 3 million.
I would, as a member of your committee, I would support that. I think we can make that 5% if we are a little more, I'll use assertive.
Okay, can I have a motion on that?
I'd like the board to consider transferring $3 million out of our Cal Trust account and transferring it into the California class investment account. And that would make about $4 million in our investment California class. With their returns on this last cycle at 5.5% versus 2.93% for Cal Trust, the difference is essentially 2.5%.
Yeah.
And I think it makes sense. And after again listening to Nigro, I think it makes sense.
Could you explain the securities behind that account? I mean, is it, FDICA or who's got the?
It's the exact same safeguards and securities that a Cal Trust and Lake would have.
Okay.
They're not going to suddenly be out there, investing in crypto.
They just have the current interest rate.
I still think gold and silver is the way to go, and I really don't want that.
Well, what it really impressed me.
He's right, though.
In visiting with them up in Monterey was the list of their current entities that were participating in the program. If it's good enough for them, it's good enough.
Absolutely.
I know.
Yeah,
So
no,
that's,
I'm all for it.
that's my motion.
Can I have a second on that?
Second.
Okay, any other discussion? I would just add, I agree with Terry, Cal class had a very big presence out there in Monterey, and to see all the other special districts that are kind of jumping on this opportunity. I think that they said maybe that they have 5 billion in total assets, you know, and it's a fairly new fund, but I think it's just utilizing the same sort of protections as prior, but now it's getting the more current saving rates. So I think that it's a very smart decision.
Yeah, I always agree.
Go ahead.
Director Brown,
Aye.
Director Leach,
Aye.
Director Morales.
Aye.
Director Jeffrey.
Aye.
Thank you.
Okay, so we just have one agenda item here left. It's the site logic pro forma. So we got this in just at the last minute. Hope everybody saw the email and had a chance to kind of go over it a little bit. Rachel, would you like to present
Sure.
it or say anything about it here?
Yeah, and the expectation wasn't that we were going to make a decision on it tonight because it did come in so late. The idea was it would be presented so that you could be familiar with it, look at it, get some general interest. The pro forma that they've provided to us really shows the details. It's really tiny on the screen. So yeah, that, you want to go back to the previous one? That's previous slide. Yeah. let's see if you can
Everybody has a copy.
fit it
too,
all.
right?
Yeah, yeah, what they're basically providing for us is the idea that even though the project has a $1.4 million cost to install, they are confident, I will say, was the word they used, of a $310,000 Inflation Reduction Act rebate that would come back to us in the first year that would decrease the cost of the project by about $310,000. Utility incentives, some county contributions, that's probably neighborhood enhancement grants and such. The idea was we've asked them to give us this initial pro forma. We'll have them come and we'll do a special meeting just to go through this, and they will walk through their rationale of how they came up with these numbers, the costs, and how the program generally works and how it would recoup our investment over the 30-year lifespan of the actual equipment. And that's where they come up with a 30-year cumulative program savings of $2 million. So it's obviously investment forward with the expectation that we earn it all back in our utility savings. One of the challenges, obviously, with this project is we know that the wellness center was pretty much sitting vacant for a while. So when they went back and looked at our utility costs before the last year, our utilities were very low because we weren't doing anything over there.
Well, no, they'll work.
Well, that too. But because we weren't in the classrooms, we weren't running HVAC throughout all the education building. In my conversation with them, I said, well, we need to be able to say we're gonna scale. So they want to be able to communicate a phase conversation with us as well. Again, that was something bigger than we thought this meeting would be able to handle. And I've asked them to come back with a little more details. The idea is that they could also provide us, if we were to finance this project and not pay for it with cash. The idea is, what would that cost add to the project? I indicated that initially the board did not show a strong interest in financing.
Well, if financing costs us 6%, when we can make 5%, I mean.
Right.
That's upside down, so that's an easy decision to make.
That's kind of why they gave us just the cash price one, but that was part of the back and forth with them. So the expectation is Site Logic would come back. They could walk through the details of this complicated spreadsheet that you have in here, but I wanted to make sure that you at least got that. in advance, so you can start to see facility cost savings. You'll see there's some maintenance services that are built in there, the energy maintenance, management services. This is essentially Site Logic to continue to make sure that they're overseeing and making sure that we're getting the right billings, the system is running efficiently, all that. But I wanted to at least present it here, make sure that you had it, could start to look at it, start to form your questions. And then we could look to schedule and have them come back and walk through the full piece. That way you could come back with your questions to them at that time and specifically be able to make sure that you've got all things filled out and understood. And then that way too, if Jeff has any specific questions as far as process, they could be on site, we could have a full conversation.
What I would want to see is some real detail on each of these elements. For example, the parking lot restoration, entry, main, ramp, whatever. I want to see what they're talking about, what they're proposing to do. If they're just talking about putting some sealer down and restriping, that's not gonna cut it.
Yeah.
No, it's, yeah, it's absolutely taking it to the dirt,
Well,
but,
I want to see that in writing.
okay.
And I want to see the proposal on that. The same for the lighting that they're proposing to put into the parking lot. Is it gonna be one bulb or is it gonna be a full set of, you know, whatever it's gonna be, I want to see what it is. At least, this board member would like to see some detail.
Right.
Yeah.
Specific details.
I'm experiencing this as a sketch and we need the full portrait.
Yes.
And everything that has to do with that. Point of curiosity, the column heading number 3, facility replacement cost savings. Because I've always been worried about deferred maintenance and keeping up with it versus regular maintenance. And the fact that it ends in year 9, is this a column that speaks to getting things up to snuff? So we don't have to replace it later, or?
That is my understanding of it.
Okay.
Yeah.
Well, I'm glad they're paying attention to that because we've got to account for that in any cost.
Right.
We do, so, okay.
And the phase component, this initially also talks about the infrastructure of the shade structure being large enough, even though it wouldn't have all full solar panels yet.
Right.
Knowing that if we phase 2 and we see that the wellness center suddenly starts sucking a ton of energy because it's in full steam ahead and every room is full all the time, we would potentially need to add more solar to be able to offset that increased utility cost.
Well, let me just say from my personal experience on solar, that we need to go for as big as we possibly can.
Yeah.
I have solar on my own, and I have a big solar system. And they wanted to sell something not so big, and that wasn't gonna cut as far as I was concerned. I have 55 panels on my roof. My point being is, we need to put as relatively big as we can. As far as we've got the space, the difference in the additional cost is not gonna be that much, I wouldn't think. So we'll
Yeah.
take or go home as far as I'm concerned.
And the other part that I was negotiating back and forth with, which is a little bit what delayed this, is in here does not have the battery backup system, which we had originally had a conversation was important to have over at the wellness center spot.
Yeah,
If
I think to have it as an alternate, cooling center or whatever.
Exactly.
Total sense.
Yeah, if we are to be in a cooling zone in an off the grid situation, we would need to have our own power source. And so that was the back and forth conversation, which is why I feel this is still more of a conversational level and not a decision level at this point. Okay,
So they
so,
need to be able to tell us if we're gonna have a 100 kW unit to run what we have in mind, and I would expect that, and that's a couple $100,000. It wasn't my nursing home, I can tell you that.
yeah,
Understood. Do we have, I'll just open up real quick, any public comments on this item? No. For me, what I would propose is, if any of the board members have any specific technical questions, if we could relay those into Rachel, as soon as possible. And then we can get, specific answers, or they can come prepared to give more specific detailed answers for questions that we might have. Personally, this board member, I'm really not looking to delay things another 6 months before we figure out to make a decision. I think that we want to definitely get the parking lot done. I think that everybody wants to get that done. We need to get that done over there. And I think a lot of this is really intriguing. You know, I'm definitely interested. You know, I would ask that, we ask them to come back sooner rather than later.
Oh,
I'm
yeah.
not looking to wait till after the holidays, if they can come
Yeah.
next month.
Oh, they could, yeah, they indicated to me that they could be very responsive to us,
Yeah.
as far as
I-
looking at schedules.
Yeah, no, I mean, I think that the whole process is just something that takes a long time, you know, even to prove it. So I think that, it would be better for me if they were to come back quicker. That way we can.
I
we
agree,
can-
even
we
if it's
can-
a special,
Yeah,
absolutely.
and even if we decide not to do it, I mean, at least
Yeah,
we'll do
yeah.
it sooner and we'll figure it
Yeah,
out
yeah.
sooner, you know?
Well, no.
But it seems like, you know, I mean, fairly basic information, some quick questions that I had right off the bat were, you know, do these numbers match our current utility use?
The numbers are based on our current and the expected based on what we're using now.
Yeah,
No,
5% increase.
Yeah, and that's where the math got a little wonky.
Are we,
I-
like this year, are you planning on 18,000 for the electric bill? Is that the?
Oh, I would say that's
Okay,
a
I would say-
conservative.
I would agree with that.
Yeah, I mean, if we see the rooms being full like we are expecting and the heat pump systems are running.
Correctly.
Right, and because everything in building B is brand new as far as those, except for that last set, which we're working on having that done. Those rooms weren't in use
Yeah,
last year. So now that they are, you know that utility cost is going to go up.
yeah.
Plus, when it's
put our vehicle EV charging units in, that's gonna be drawing some power.
Yeah, I mean,
Yeah.
those are all of those pieces put together.
Yeah.
So that's where I would say, we need to have them walk us through this. I can't begin to claim that I'm an expert. I understood it when they walked it through with me.
Yeah.
And I felt they needed to come and do that here, but I needed to get more info and we just couldn't align it with this meeting.
For sure. Understood. One other thing, maybe we can get it, but the EV charging revenue. It's, I think, pretty aggressive. I'm not really sure, you know, what the general cost is or revenue for something like that. I know that FPUD has a similar setup. Maybe if we can reach out to them and
the
if we
library.
can get, the library as well, if we can get some sort of data, at least to have an idea how many people use it, how much utilization they get. I mean, I'm not super caught up on, we have to make a ton of money off of it. I think that, you know, if it powers the facility and we have the parking lot and a lot of our needs taken care of, I don't think that's the biggest element for me, but, you know, they have, you know, almost $500,000 in revenue here, you know, obviously over the total lifespan of the program, but
Right.
it'd be nice to have a good idea about how much use it's gonna get and how many people use that type of charging system. And I think what they were proposing is exactly what, they have at FPUD. So,
Yeah.
if we could kind of figure that out, that'd be good.
Yeah, I can reach out to Jack and see if he can provide any of that info for me.
I think that would be
The
helpful.
library is more difficult because it's the county
Yeah.
base,
Yeah,
but FPUD, I'm sure Jack. would be
but we
more
can
than
call,
sure.
our county supervisor staff and ask them
Yeah.
to bust it out.
I'm
for
sure I
us.
can.
I'm sure the gym would be happy
Jim
to
would,
do that.
Jim would. help us.
You bet, you bet.
Yeah.
You know, Temecula Valley Hospital has a ton of EV units in their parking lot.
Okay, I'm just glad to see, what I'm glad about is we're gonna have time to digest.
Yes.
And generate questions, and I think that, actually, I'm glad it didn't come here with them here, because this is a lot to digest.
We would have sent him home empty-handed more than likely. Yeah.
Well, and even at the workshop, I would say, we're probably gonna wait until a meeting to do anything formal. I think we're in the right track if we can get them back sooner than later. I'm with you.
Yeah, well, I think, you know, and I think that the process is good for us to be able to sit on it for a couple days. Think up
Yeah.
you know, more questions, give them a chance to do some research if we have any questions, because, at the end of the day, I mean, it's a $1.4 million. I mean, personally, I've never spent $1.4 million, you know, but if I did, I would be doing a lot of thinking and, you know,
Sure.
a lot of research on that or whatever, so, you know.
Don't worry, 5% interest will build that up.
You know, I think it really comes home when we see all the impact at the facility and some of the programs going on and you know, Wednesday nights, everything going on over there, and then you hear the impact from the people that are you know, impacted by the programs that we're doing. You know, it's all worth it. So
that's what we're in business for sure.
And just a add-on note, builds on Ion Health and everything at the wellness center. One of our neighbors that's been there the longest time, that we share the longest fence line with, he came by the event, he and his daughter, and they love being our neighbor.
Wow,
So
that's unusual.
right, well, I'll mention that they also add a lot to the ambient noise. Yeah, and we actually get a lot of good conversation about the chickens, but they were incredibly gracious to us and said, hey, if you ever need to park cars on our lot, just let us know. I'm like, totally appreciate that. No, but totally appreciate that. But it was really nice to be able to have that neighbor be involved there. I got a phone call from a new neighbor, somebody who bought something else that's on the El Rancho side, knowing that it's us, and he reached out about a fencing question, which was fine. I said, you know, how do you like being our neighbor kind of thing? He says, you know what? I love it when the drum circle people are there.
They are fun.
The one thing I was really nervous about saying, yes, we should do, because I thought it might be too disruptive, but brand new neighbor, he moved in last December, and he's like, I love it.
It's so
Great.
important to have good neighbors.
It's important to have good
And
neighbors.
be good neighbors.
Right.
And be good neighbors, absolutely.
And I mean, obviously, Roy was able to provide the list of who the neighbors were, and we have sent initial letters to them and said, you know, please reach out to us if you ever have a question or concern. We've not had any, obviously, except for these two folks. This is the first time, and both were positive incidents, so that was good.
Wonderful.
Great.
Okay.
Awesome. So yeah, so looking forward to seeing that hopefully soon. And so last thing, any other board member comments or items for subsequent meetings?
I have a question with regard to, we still have the senior citizen center visitation going on tomorrow?
Yes.
Yeah, because that's on my calendar on my desk at home. So.
Good.
And then secondly, I saw the email with regard to the Senator Brian Jones event from last week. Is that a sanctioned event? In other words, if we went to that,
Well, you indicated to me that you were going,
I did.
and I considered it part of a district event, so yes, it would go. If your question is, does it go on the stipend report, the answer is yes.
Yeah.
Okay.
Well, especially because the Fallbrook Food Pantry had a great booth set up
Yes,
there.
they did.
And I got to spend some time with them, but they were making a great presence. And our name was mentioned a number of times as being one of their sponsors and supporters. So yeah, that was good. That was good. There were a lot of people there.
Yes.
Anybody else? Just for me, I just wanted to, you know, just how far the district has come, since I came on the board, you know, 6-7 years ago, from kind of sitting in some of these meetings and just, you know, 2 employees, 3 employees of the district, and really not a whole lot going on to see, you know, how much the staff has done, and you know, it really makes you proud, like, to be a part of the district and see the impact that the staff's making. So I really, again, commend you ladies. I think that the work that you're doing is amazing, and as a board, I mean, it's great to be able to support that. And I would just, you know, continue to say, keep coming back to us with the results and anything that we can do to make your job easier and to try to impact more out there in the community, because it's working, and it's, you know, it's great to see the impact. So thank you very much.
You bet. And thank you to Rachel, because you're the ones that hired them.
Yeah.
I think all the staff's doing a great job, and to see like even just the coordination with that event, I mean, I've been to some of these events where it's a mess or nobody shows up, or like, you know, it's just really hard to predict how some of those things go, and to see all the staff out there working hard, and it's all well, yeah, 18 for sure, so very well done.
A+.
So we have a number of calendar items here. Obviously, last month was really slow for us, so as you see, the full committee schedule coming back.
It's all back.
We're back.
So looking forward to seeing that, and with that, we'll go ahead and adjourn.
All right.
Thank you.
Thanks, Jeff.
I have